I never knew that structural dysfunction was a root cause for so many things, even hormonal problems, neurological dysfunction, digestive problems, etc. I didn't know that simply because the way the skeleton was deformed, that it was affecting the organ structures so much. I mean, even yesterday at a cardiology treatment from Dr. Roth, I heard my own um, cardiac murmur go from swooshing to nothing simply by doing some pericardial work on the upper thorax.
It was discovered at the University of California, the actual mechanism that causes this, and they verified that literally bone gets bigger with injury and literally changes its shape. If you have bone that is bigger, it's putting stress on ligaments and muscles. Nothing's going to work properly. You're going to have joint stress, you're going to have tension, you're going to have pain. So it's a question of finding out where that deeper injury is, and it's often in the bone, but even the internal organs absorb that.
Now I'm 8 years into my career, and I look at my other competitors, and they've not been able to keep up. We all take the same amount of falls and crashes and impacts, and I think it's because of this treatment that I've done and that I've stayed on top of. I think it's the reason why I've been able to compete and ride at the level I have without having any setbacks from not being able to like bend in a certain way or be as flexible as I can.
Works really, really well with concussions and all kinds of trauma. Yeah.
I always tell people if I have to go back to the old way of doing things, that as a chiropractor, that I just buy an ice cream store. I couldn't do it, couldn't go back. It's pushing rocks uphill. Are you starting to see that? You're fighting with a lot of the other types of body work. You're pushing rocks uphill. And this is the hill. What Dr. Roth is showing you is what the hill is. It's much easier to push rocks downhill. And that's what this work is. It's pushing rocks downhill. And I can't push rocks uphill anymore.
This is a revolutionary new way of understanding the reality of anatomy, physiology, pathology, and treatment.
I got a pretty complicated patient, and she had had post-concussive syndrome for just about a year and a half also, but she had been beaten in her line of work. She worked in a mental health institution. And when she walked in, she had a shoulder that was elevated by 3 inches. She couldn't move from out of bed without having her head contained with a tight wrap on it. The neurologist recommended that they shoot lidocaine up into her brain to deaden the cells, to deaden her headache. She couldn't go anywhere without dark glasses. And within that 1 hour, her pain went from like a 10 out of 10 to when she left, she said it was a 0 out of 10. For the first time. And when she went home, her family said, "What did they do to you? Did they break your arm?" It was just great because her change was so dramatic, and it took 1 hour to get from here to here, and from kind of tight and uncomfortable and protective to open and smiling and hopeful again. And that was amazing.
So the very first person I treated with rheumatoid arthritis for 30 years, 65-year-old woman, I just working on the long bones of the legs, just the shafts, for 20 minutes, right? She comes back 5 days later. I said, "How are you doing?" She says, "Well, I'm out of pain." I said, "What do you mean you're out of pain? Like where?" She said, I'm thinking she's like my hips or my knees or my hands are a little bit better. She says, "My whole body, my pain's gone." I goes, "Really?" Yeah. She goes, "Yeah, not only that, my energy's returned." She said, I said, "Really?" She said, "Yeah, I've got my energy back, And she's not only that, she says, "My mind's cleared." She says, "I feel young again." Really, I'm just working on the long bones of the legs, and you get that kind of, patients that know me, and I've treated for a while, I say, I really don't know what I'm doing yet, because I haven't really used all the procedures yet, right? And it's just like amazing. You're just seeing more and more procedures you're using. You're just getting more and more better results. It's just, the sky's the limit. Like you don't know where it's going to stop.
There was a woman who had post-concussive syndrome, and she was on the highway in a car that was at a complete dead stop, and she was rear-ended by a car that was going 70 miles an hour. And after her second appointment, after we had finished an hour of Matrix, she sat up and she said, "It's gone." And I said, "Well, what's gone exactly?" And she said, "I have no pressure in my head, and my headache is gone. The ringing in both of my ears is gone." I just got a text from her every day saying, "It's still gone. It's still gone." And the next time I saw her, she came in, and she came a half hour early to her appointment because she couldn't wait for her appointment. And she came in and she was dancing around, and her daughter came with her, and her daughter said that it was like having her mom back. Like she had lost a family member that was now back. She called it her sparkle. And she said, "I have been flat for a year and a half with no ability to break through it ever, even for a moment. And now it's back all the time." And so that was really something. And I'm still so excited. I mean, that every time I see her, she's just getting better.
You're treating the structure of the body. This is something that is an important part of our body. We can't ignore it. You know, you may say, I'm going to treat the fascia, I'm going to treat the joints, I'm going to do this and that. But if you're not looking beyond that, and you're wondering why things are not improving or staying the way they're supposed to, maybe this is where you need to be looking. What we've found in our practice is we can reverse that very, very quickly. We literally see changes in the bone size back to normal. And it's kind of wild when you start to see these changes.